Dr. Amish Hadalja is a senior scholar at the Johns Hopkins Bloomberg School of Public Health and Center for Health Security. Thanks for being with us. Let's start with the vaccines. This is just the first step. There's concern across the country as states are taking different approaches on who gets immunized. That's our federal system. But are there medical ethical issues here that need to be addressed? There's so many vulnerable populations, particularly minority communities, Black and Hispanic communities, who are many of the frontline workers. But others are also arguing for firefighters, teachers, to get kids back in schools. The meatpacking industry has been so disproportionately affected. And then you've got the whole category of seniors. Should it be all seniors? Should it just be seniors with comorbidities? How do people, especially governors who are politically, compromised potentially, and people, could be lobbying them, how do you make sure that this scarce commodity right now gets to the right people?
It's going to be very difficult. The easy part is healthcare workers and nursing home residents, because we know that makes a lot of sense to vaccinate those groups first. But when you start thinking about how each state defines essential workers, it becomes a little bit more difficult. What we have to keep in mind, though, is that the overall impact of this vaccine is to decrease the harm that this virus is causing. And what we're worried about is the disruptions to our lives, as well as hospitals going into crisis. So I do think that there is a role for, when you look at essential workers, there can be some variability, but I do think law enforcement, firefighters, first responders, teachers, those people who work in meatpacking plants, and maybe in some essential government workers, those are probably going to be considered essential in most states. But there's always going to be some debate, and I think it's going to be very difficult. And hopefully the CDC, the ACIP, as well as some of the professional organizations are going to start to be really clear about who should get the vaccine first. But I do think it's going to be.
And I know because of continuity of government, there was the thought that essential government workers, senior White House staff included, but there are a lot of people who immediately reacted because the White House has been notably resistant to wearing masks, and it has been a super spreader location. The Rose Garden event, we don't know about the holiday parties, but certainly the election night parties led to a lot of people becoming infected.
Yeah, I agree that I don't think that the White House should be put in front of nursing home residents, put in front of healthcare providers, right. Maybe the White House medical unit, but not the general staff at the White House. They should stay in line just like everybody else. And if they are individuals that are part of those high-risk groups, they can be vaccinated at the time that they would be called otherwise. There is an argument for some of them as essential workers, but not before nursing home residents, not before healthcare providers, especially since this White House has been a fountain of misinformation and evasion. And the reason that we're all relying on a vaccine to get us out of this is because decisive action was not taken by this White House in January, February, and March, when things could have been a lot different. So I do think that it makes a lot of sense to put the White House behind healthcare workers and nursing home residents.
And this morning, Dr. Fauci was on with Hallie Jackson, my colleague, and talked about when average Americans, like all the rest of us, will be able to go to your local pharmacy, get the vaccine. Here was his answer.
I had been saying, by my calculation, sometime by the end of March, the beginning of April, that the normal, healthy man and woman in the street who has no underlying conditions would likely get it. At the end of the day, the real bottom line is, when do you get the majority, the overwhelming majority of the population vaccinated so you can get that umbrella of herd immunity? And I believe if we're efficient about it and we convince people to get vaccinated, we can accomplish that by the end of the second quarter of 2021.
So that is probably the most reasonable projection. We've heard much more optimistic projections from some of the other health officials, but he's saying the end of the second quarter. Does that make sense to you?
It does make sense to me. This is going to be a Herculean effort to get this vaccine into the arms of Americans and cross that herd immunity threshold. So I do think we're looking, well into 2021 before that happens. However, it's important to remember things will start to change as we get our vulnerable populations vaccinated. We won't hear about hospitals in crisis anymore. The threat perception and the risk perception are going to change once we kind of defang this virus by getting our vulnerable populations, which still represent the majority of people who are getting hospitalized and who are dying, vaccinated. And when healthcare healthcare workers, when other essential workers feel safe to go about their lives, I think we will get to some semblance of normal. But for full normalcy, or the closest to normal we're ever going to get post-pandemic, it's probably going to be mid-2021, as Dr. Fauci stated.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.